Hi, and welcome. Come on in and get comfortable. We're going to make your health insurance benefits feel a whole lot less confusing. By the end of this, you'll understand exactly what you owe, why you owe it, and how to protect your wallet all year long. All right, let's get started with the basics because once you understand these core terms, everything else in your plan starts to make a lot more sense. Here's our agenda. We're going to cover the 5 core concepts: copays, your flat fee at the door; deductibles, what you pay before insurance kicks in; coinsurance, that's the percentage split after the deductible; the out-of-pocket maximum, which is your safety net; and Medicaid spend down. That's a pathway when your income is just above the limit. A copay is a fixed dollar amount you pay each time you use a healthcare service. Primary care visits typically run between $20 and $40 per visit. Prescriptions typically range from $10 to $60. The lower end of that range reflects generic pricing, so it's always a good idea to ask about the generic option. Urgent care is usually between $50 and $75, which is significantly less than an ER visit, which typically runs $150 to $350. And telehealth is often free. One key thing to remember, copays typically do not count towards your deductible. They are a separate billing bucket. Your deductible is the amount you pay before insurance starts sharing costs. Until you meet it, you pay 100% of the allowed amount for covered services in addition to your copays. For example, with the $1,500 deductible, you pay that first $1,500 each year. After that, insurance kicks in and shares the cost with you. Here's an example. You visit your doctor and you pay a $30 copay. That part is flat and it's done, but it does not reduce the amount of your deductible. Then while you're at that visit, the doctor orders an x-ray. The allowed amount of the x-ray is $280. Since you have not met your $1,500 deductible, you will owe the full $280. That will bring your remaining deductible amount to $1,220. The copay and the x-ray come from 2 separate billing buckets. Same appointment, but very different rules. Here's another example. Let's say the allowed amount for a specialist visit is $2,500. Once your deductible is met, your coinsurance kicks in with an 80-20 split. Insurance covers 80%, that's $2,000 of our example amount of $2,500, and you owe the remaining 20%, which is $500. If your plan is a 70-30 split, insurance would cover 70% of the same amount of the $2,500, which would be $1,750, and you would pay the other 30%, which is $750. These plans often come with a lower monthly premium, but when you actually use the services, the amount you pay out of pocket will be higher. That's the heart of coinsurance. After your deductible is met, you're paying your percentage of the allowed amount, not the billed amount. Coinsurance is not a flat fee. That's your copay. It's a percentage that typically kicks in after you've met your deductible. At that point, you and your insurance split the remaining costs based on your plan's ratio. The key things to remember are know your split, know your deductible status, and always ask what the allowed amount is, not the sticker price. And just so you're aware, most plans apply coinsurance after the deductible, but there are some plans, depending on how they're structured, that may apply coinsurance differently. Always check your summary of benefits to know exactly how your plan works. Your out-of-pocket maximum is the most important number in your entire plan. Once you reach it, insurance covers 100% of your covered medical cost for the rest of the year. For ACA compliant plans, the 2026 federal limit is $9,200 for an individual plan and $18,400 for a family plan. Your deductible, your coinsurance, and most copays all count toward this number. It resets every plan year, usually on January 1st, so you start fresh at zero. And just a quick note, if you have coverage through your employer, your out-of-pocket maximum may be set differently. But no matter what, the federal law says it cannot exceed the annual cap that the ACA establishes. So there's always a limit in place. Think of your benefits like a ladder you move through over the year. Rung 1, your plan year starts fresh. Rung 2, you're paying copays and covering costs until you reach your deductible. Rung 3, your coinsurance kicks in and you're sharing the cost with your plan. Rung 4, you reach your out-of-pocket maximum. Rung 5, once you're at the top of that ladder, insurance covers everything for the rest of the year. When you know which rung you're on, every bill becomes a lot easier to understand. Medicaid spend down is a pathway many people don't realize they qualify for. If your income is slightly above your state's Medicaid limit, some states let you spend down the extra amount by using your medical expenses. Doctor's visits, prescriptions, dental, vision, and even insurance premiums can all count. For example, if the income limit is $1,200 a month and you earn $1,450 a month, you're $250 over the income limit. That means you need $250 in medical bills to meet your spend down. States usually set the spend down period as either 1 month or 6 months. That's the window of time you have to show enough medical expenses to meet your spend down amount. Now here's the key watch out, and this one is important. Not every state offers a spend down program, so the first step is always confirming whether your state participates. And here's something people often miss. Your medical bills do not have to be paid to count towards your spend down. They just have to be incurred and properly documented. That distinction alone can make or break someone's eligibility. Keep every receipt and statement. Documentation is everything with spend down programs. Before your next appointment, take a minute to check a few key numbers. Look at your copays, your deductible, and how much money you've already paid towards it. Your coinsurance rate, your out-of-pocket maximum, and the difference between the in-network and out-of-network cost. Most insurance companies have apps that show all of this information in real time. A little bit of checking ahead can save you a lot of money because in healthcare, knowing your numbers really does protect your wallet. 5 quick takeaways. Copays are flat fees and don't count towards your deductible. Your deductible resets every year and you pay full cost until you meet it. Coinsurance is the percentage you pay after that. Your out-of-pocket maximum is your safety net. Once you hit it, insurance covers everything for the rest of the year. And if your income is just a little over the Medicaid limit, spend down may still help you qualify. Take these 5 things with you, and the next time a bill lands in your mailbox, you'll know exactly what you're looking at. Thank you so much for spending time with me today. Remember, the more you understand your benefits, the more you protect your wallet. This video is for general education only. It's not legal, financial, or medical advice. Always check your own plan documents or talk with your insurance provider if you need specifics for your situation. And if you want more simple, clear breakdowns like this, you can always visit sunnyvibes.com. Stay informed, stay empowered. Understanding your health insurance is one of the most powerful financial tools you have.